Your body is a masterpiece of complex yet wonderful processes that may leave you puzzled sometimes. One day, a chemical or compound is your friend, and the next it becomes an enemy that destroys your normal bodily functions and affects your daily routine. Histamine is an example of a chemical that can be both a savior and a threat to your health. In this video, we will find out what it's like being histamine intolerant, how to detect the early signs of it, and how to treat this condition. Histamine is a chemical that plays three significant roles in your body. In your brain, it is a neurotransmitter that sends messages and helps in regulating sleep, arousal, and hormonal secretion. In your stomach, histamine aids digestion by stimulating the release of gastric acid, which activates digestive enzymes and breaks down proteins in the gut. For your immune system, histamine reacts during an injury or allergic reaction as part of your immune response to foreign substances that may cause health problems to your body. However, overproduction of histamine may cause discomfort and adverse effects if your body fails to break it down through the enzymes called diamine oxidase, or DAO, and histamine methyltransferase, or HNMT. These two enzymes are involved in the metabolism of histamine to prevent a condition called histamine intolerance. Histamine intolerance, or HIT, happens when your body produces too much histamine and falls short of the enzyme DAO, or HNMT, to break it down. This condition is often confused with true allergies because HIT may have symptoms that overlap with other conditions, such as seasonal allergies. HIT is different from allergies, but histamine is a chemical that causes allergic reactions due to its protective function in the immune system. The main difference is that HIT is caused by the buildup of histamine, while allergies occur when your body's immune system responds to allergens. Intolerance for histamine occurs when your body fails to digest or process a substance due to its lack of certain enzymes. In the case of HIT, lack of DAO and HNMT enzymes may trigger the intolerance. It may be concluded that histamine intolerance develops due to a group of histamine-rich foods or lack of DAO enzymes, while an allergy may develop due to a particular food or harmless substance. Histamine is naturally produced by your body, and it comes with an enzyme called diamine oxidase. But the most common cause of histamine intolerance is DAO deficiency, which can happen due to consumption of histamine-rich foods that defeat the function of the DAO enzyme, persistent gastrointestinal disorders such as inflammatory bowel disease, medications that prevent the production of DAO enzymes such as pain relievers, antibiotics, diuretics, antidepressants, foods that trigger the production of histamine, increased growth of bacteria in your gut. When your histamine overproduces, the normal DAO enzymes will find it difficult to break down high histamine levels, resulting in intolerance. It is commonly known that most symptoms of histamine intolerance may happen in the gut, lungs, and other parts of the body, depending on where the high levels of histamine are released. Allergy-like symptoms of histamine intolerance include runny nose, watery eyes, itchy skin, swelling of the extremities. Histamine develops allergic reactions because of its role on combating foreign substances that enter your body, and it is also vital in fighting acute inflammation by acting as a chemical mediator and increasing vasodilation. Vasodilation refers to the widening of blood vessels to increase blood flow throughout the body. Other symptoms of HIT that involve the gastrointestinal are bloating, diarrhea, and an upset stomach. When you are DAO deficient, histamine is not broken down, and your GI tract fails to absorb the food component properly, resulting in overproduction and eventually intolerance. To cure this, you may consider taking supplements, foods, and drinks that contain probiotics, quercetin, and bromelain. Probiotics help in cleansing the gut, while quercetin and bromelain are natural antihistamines and have anti-inflammatory properties. If you want more of our informational content, join our growing family by subscribing to Natural Education and turn on the bell icon so you'll be updated with our future videos. As now we know what causes HIT, how can we cure this health condition? Well, there is no exact cure for histamine intolerance yet. What you need to do is minimize and eliminate the symptoms by reducing the consumption of histamine-rich foods and eating more fresh foods and drinks that contain lower histamine levels. There are three types of foods and beverages that may cause histamine intolerance when you consume them too much. The first type are those that are naturally high in histamine. The second type are those that trigger the release of histamine, and the third type are foods that interfere with DAO and HNMT. Fermented foods and drinks that are high in histamine include kombucha, yogurt, smoked meat, alcohol, and aged cheese. Meanwhile, foods that may trigger the release of histamine are citrus fruits, egg whites, peanuts, tomatoes, chocolates, and fish. Foods that may interfere with the enzymes DAO and HMNT include energy drinks, green tea, and black tea. Alternatively, to combat high histamine levels, doctors may recommend a low histamine diet, which may include the following foods: fresh meat, cooked egg yolks, fresh fruits, and vegetables except citrus fruits. Take note that aged or fermented foods and beverages tend to have higher levels of histamine, while fresh foods are more likely to have lower histamine. As the food or drink ages or ferments, it tends to develop more histamine content than the fresh ones, so avoid eating processed foods to prevent your histamine levels from going up. Additionally, some of the best compounds in plants that act as natural antihistamines are quercetin, bromelain, stinging nettle, and butterbur. Quercetin is an antioxidant that may be found in apples, grapes, and onions. Bromelain is a compound that's present in pineapples, asparagus, kiwi fruit, and ginger. Bromelain may treat inflammation and respiratory symptoms that's linked with allergies. Meanwhile, stinging nettle and butterbur are herbs that are proven by natural medicine experts to reduce the symptoms of HIT, such as migraines and nasal congestion. There are also vitamins and minerals that help DAO and HNMT to function properly. Some of the beneficial vitamins and minerals that you should consider taking to lower histamine levels are vitamin B6, B1, B2, vitamin C, calcium, copper, magnesium, and zinc. Diagnosis of histamine intolerance can be difficult because there is no specific medical test that detects it. There is a test, however, that measures DAO activity and histamine levels, but they don't often correlate with the symptoms listed above. Signs and symptoms of histamine intolerance are often related with other conditions, such as true allergies, gastrointestinal diseases, fructose malabsorption, or inflammatory bowel disease. Diagnosing HIT can be done through a process of elimination. That is why it's best to consult a medical professional before medication. Did you find this video helpful? Give us a thumbs up if you did, and don't forget to share this video to your friends who may be experiencing histamine intolerance. Speaking of intolerance, you may also watch our next video about what it's like being lactose intolerant and what are the main symptoms that you could expect if you are one. Give it a go and let us know if you enjoyed it.